talked about doing that, but then we didn't have very many youth register for it. So then we got back together and we decided, you know, we probably should do some, have a time for our staff and our volunteers to get together to talk about how we can support our young people and their mental health during everything that's happening. We have scheduled a youth component that everybody will be getting information on. Hopefully by Friday, I can get that sent out to everybody, that we will give the youth an opportunity to talk about their own mental health. But you know, I think it's really important that our adults and our adults who work with the youth have that opportunity as well. So I'm going to start the PowerPoint just so everybody, okay. So just so everybody is aware of who helped kind of pull this together. So myself, Bill Evans from College of Education. Most of you know Bill. Pam Payne from the College of Education. And if you don't know Pam, say, Bill and Pam, you guys can say hi so you can pop up on their screen.
Hello, hello.
Hi.
All right. And Pam is a faculty member in the College of Education. She does have she also has an extension appointment. And then Sarah Savilicek and Nora Luna. And then we also, Brian Lucky, who's a graduate student. Most of you know Brian through our work with the Common Measures. So, all right. We're going to start by asking you guys a couple of questions, just to see how everybody is doing. So if you can answer this question, it is just, how are you doing? On a scale of 1 to 7, 1 is you're extremely stressed and struggling, to 7 that you're not stressed at all. And these are all anonymous, so none of us are gonna know who voted or how you guys voted. Got about half of you that have voted. Give it another 10 seconds maybe. Okay. So it looks like we are, you know, most of us are around that 2 to 4, so pretty stressed. You know, pretty stressed with what's happening. Thank you very much for letting us know. Now, how do you think your volunteers, how are the volunteers doing related to mental health, to their own mental health? Okay, most of us voted. So, okay, so you think our volunteers are doing a little bit worse than we are related to mental health. Interesting. And then finally, how do you think your youth are related to mental health? Okay.
Are we talking all ages of youth?
It was all age. I just said, you know, youth in general, so it could be all ages. Yeah. Okay, so we think, you know, our youth are kind of pretty stressed out to kind of middle of the road. Okay, thank you. Just kind of gives us a feel of where people are. And so just a couple of things to let you guys know. We've designed this specifically for a time for you, both as, or, you know, personnel and or volunteer. Obviously, I'm going to use the same PowerPoint for both presentations, so they're combined, to discuss where you think the state of youth mental health in Nevada is and what we can do to support our youth. You're going to be driving the discussion, but we have to remember that one person should not dominate the conversation. We want to allow everybody to have that opportunity to speak, and we want you to speak, not just sit back. So this is really for you. The discussion will, the other piece is we're not going to get political. If the facilitators see that it's getting political, we're going to move it in another direction or, stop that conversation. So, and, we're not always going to agree or, we're not going to always agree or see things the same way. And it's okay. As we always say in 4-H, we're teaching youth what to, or how to think, not what to think. Sorry, I almost got that mixed up. And it's okay to not agree with everybody. We need to value that everybody has an opinion. We may not agree with their opinion, but everybody does have their own opinion. And so we need to remember that everybody has the right to and the responsibility for that. We should not criticize or pass judgment about another person's thoughts, feelings, or their point of view. It's fine to disagree, but we need to remember when we do that, we do it respectfully and we use I statements. And then we would like you to use the chat box for, you can use the chat box for discussion. If you don't have a microphone, we would love for as many people to open up their microphones as possible so that we can see, so we can see you and hear from you. And then also, use that as a parking lot. So if something comes up that may be related to youth mental health, we're really going to focus on youth mental health either during or, immediately after this pandemic. But there may be other things that you think about. Use that chat box for that parking lot. As the facilitators, we're going to be working through that process. So, all right. Okay, so the first question that we have for you that we want you guys to discuss is, what are the strengths for helping youth deal with stress in your community?
So Carrie, are you asking people to do that verbally or put it in the chat?
Verbally if we can. If you have a microphone, we would like you to verbally tell us, what are the strengths for helping youth deal with stress in your community? The strengths, this would be, it would really be either what we have or, as extension, or what the community has. We'd like to hear both.
Yeah, strengths in general.
Yeah.
A SWOT analysis for those of you who
Yes.
are familiar.
Yes.
Well, I would say this is Lindsay in Douglas County. The county opened back up, like our skate park, parks in general, places where youth generally tend to congregate. So good, bad, or indifferent, they are able to see their friends and hang out and spend some time being outside, usually exercising in some capacity.
Okay.
Along that note, Washoe County is also doing their summer day camp at the Women and Children's Center, and getting the kids together and actually letting them see other children and do fun hands-on things that 4-H has always offered, has also been helping them with some of the stress as well.
Okay, this is Don from Lincoln County, and we have, like, for instance, this last Saturday we had the shooting sports with kids and the parents. The great thing about Lincoln County is pretty much what the kids are interested in, and so are the parents. So they always deal and work together and play together really great as families at most of these events. We have several different arts and craft programs going. We have our livestock program going, the dog club. So there's quite a number of things that the youth can still do here in town itself. We have a really great mountain bike training center that's still open and the kids can use. We have all the trails all around Lincoln County. Plus, at the same time, Lincoln County has the second highest number of people in all of Nevada that go to church. White Pine County actually beats us a little bit on that, but we have the second highest percentage, and the church is very actively involved. The families are almost like that old saying, the families that pray together stay together. So they have the church as well for a very strong support for them.
Okay. Thank you, Stormy. That is, yeah, so Stormy, and people, the community is struggling, but the Nye County Community Coalition is a good resource. Okay, 4-H has been doing Zoom meetings. Okay. Yeah. Okay, great. Anything else? Okay. Our next question is, what is your community and or 4-H, the 4-H program doing that separates it from other communities? And some of you have answered that, but if other people have thoughts or ideas around the strengths. I'm seeing, you know, we're offering Zoom meetings. At least they can see their friends. May not get to touch them, but they can see them.
In Washoe, we have a number of leaders that are doing, they are with the 4-H guidelines, they are holding club meetings in parks, and they're going on trail rides and or hikes and stuff, and they're doing social distancing picnics, which means everybody brings their own food and beverage, but they have that opportunity to interact face-to-face versus face-to-Zoom.
Mm-hmm. Okay.
Elko would kind of echo what Sarah just shared, that we've been doing shooting sports practices using all the social distancing and all of our COVID requirements. We've also, had horse activities because it's easy to social distance with those. And a number of our clubs have been meeting. A lot of our families live on, you know, our club leaders may have a couple of acres, and so they have big backyards, and so the clubs have been able to meet in backyards wearing masks and everything. So some of our kids have had that chance, but in talking with them, or anytime I do see them at any activities, they're so excited to be around other kids.
Okay. Molly shared that Lyon County's had some meetings outside so they can see their friends. Lyon County is keeping state parks and lakes open and community pools, so that is helping. Laughlin's having summer stay camp doing STEM and socializing activities via Zoom. Yeah. Okay. So we have, you know, lots of meeting outside. That's, yeah. I think that has been good. Okay, so the next question, what are some of the weaknesses that in your community related to youth mental health and stress? So what do you think some of the weaknesses are? And that could be community and or the, you know, extension in 4-H.
I don't know if it's a community problem, but I think it's a problem in general in that it's such a taboo topic. You know, if you talk out or reach out that you're, you know, having issues, insert the gasp from everybody because, you know, God forbid you should need assistance or help in some capacity. So I don't know that it's necessarily my community's problem, but it's a problem in general.
I completely agree, Lindsay, which is why we decided to just jump in and start talking about it. So.
I think in Elko County, one of the challenges, I guess, I don't know if it's weakness or a challenge, I think it's probably both, is not having enough mental health therapists and other people who can help with that. I mean, we've got more all the time we're getting more, but just to meet that need. We don't meet that need. And I think related to COVID, and I don't know if we're supposed to relate it to COVID or not, but I think the negativity, whether, you know, I know the kids aren't really opening up the newspaper, but even when I just scroll through and see people that are local, just the negativity about whether it's wearing masks or just everything related to coronavirus is just so negative. I think that's got to wear down kids as much as it does adults.
You know, and yeah, that's it. You know, I look at the social media is probably the worst. I get irritated every time. So we have lots of comments coming through the chat box. Yeah. Yeah, and I agree with Bill. We have lots of, I think families are stressed out about the upcoming school year. I don't know how many, you know, when we did the survey, a week and a half ago, probably half of the counties didn't know what the plan was for schools opening back up yet. And that to me, I mean, you know, schools are really supposed to be opening up within a couple weeks, and we don't know. So, yeah.
In Lincoln County too, I would say that one of the problems for the kids is we've been having a heat wave, and some of the places that they used to traditionally cool down for decades are now completely closed. Parks and Rec did not open the public pool this year in either Caliente or in Pioche. There's a really great little wading pool 2 miles outside of town at Kershaw Ryan State Park. They opted not to open that up again this year. So many little things that they would normally occupy their time of not so much of recreation, but the relaxation parts just don't exist this summer.
Mm-hmm. Yep. Okay. Yeah. Okay, great. Yeah. Yeah, there's so, I think it's the uncertainty, you know, is a lot of it. And that causes stress. I think it was Jim, I think it's Jim that made the comment about kids take clues from adults, and that can, you know, it's filled with politics and stressors. So.
And Carrie, and I think some people alluded to this a little bit. I think maybe it was Lindsay, but if someone knows you know, if there was a family member or they personally were infected with COVID-19, it's almost like they're a pariah and they don't want to talk about it. Or if someone close to them was sick. So somehow we need to message a little more appropriately that, you know, no one's immune from this. And just because you got sick doesn't mean there's something wrong with you.
Right. Right. Exactly. I think those are all things we need to keep in mind. So then the next question kind of fills in the same thing, that what, you know, kind of answers what areas need improvement to remain competitive. Many of you made the comment you need more mental health professionals, which yes. It's, you know, lots of youth are struggling with the whole social distancing, and, you know, they want to just hang out with their friends.
Yeah, I think Brian makes a really good point. It's really hard to keep particularly younger kids socially distant, and even that concept is really challenging for them.
I don't know about any of you, but I know for myself, I find it's really hard. Like, I meet people, and especially in a professional setting, and my first reaction is to shake hands, and I have to stop. Like, it like takes a physical, it's a physical reaction for me to not shake their hand. And so it is definitely a fun thing. Anything else on that?
Well, I just wanted to ask, you know, I start hearing more and more about COVID parties where someone who is positive or has knowingly been exposed gathers friends so that they can become positive and build antibodies. Do we have any reports yet of youth across the state doing are participating in COVID parties and the dangers associated with that?
Good question, Lindsay.
I haven't heard anything yet, but you know, the clock is ticking. 4 weeks, UNR is going to open. I think that's going to be an interesting moment.
Mhm.
Once you get all the college kids congregating again, I don't know. It's going to be really fascinating to see how that goes out.
Yeah. Has anybody heard of any in their communities?
There was some mention that there might have been some of that going on in Washoe, but I haven't seen it verified, but we believe there was some stuff going on.
Okay.
Not in extension, but or in 4-H, but happening in the greater community.
Yeah. Okay. Our next question, what are some opportunities that your community and or the 4-H program is offering or we could offer to help youth deal with stress? And I know some of you have been looking at some of these opportunities. So what do you think they could be?
I just received an email from our local coalition, and that they're looking to form a youth coalition as part of, you know, the greater coalition. And I think that could possibly be one thing that could help, because maybe kids would be able to provide ideas on what they see that they really need and share that in that group. And then PACE can be looking for community grants to possibly fund those kinds of things. So I think that's a really positive thing that just happened in our county just in the last couple of days, actually.
I think that's great. Okay. Yeah. Opportunities for kids to tell us what they need. Yeah. Yeah, I agree, Haley. You know, important for youth and adults alike to learn different coping mechanisms. Yes. Kind of finding that a hobby for them, something. Yeah. Getting them active. Yeah. Okay, Stormy, yeah. Letting kids stay on and chat after, you know, if you have a Zoom meeting, you know, just like they are gonna sit out and chat, you know, out in the parking lot, letting them do that after a Zoom meeting, I think is really good. You know, doing some of those safe activities that you can do. It's good too, is staff, if we can reach out. You know, if you see a kid or you hear of a child that's struggling, if you can, you know, reach out to them and just, you know, you can ask them the question, how are you doing? Anything else?
Carrie, one thing that I like to do instead of asking if a child has questions or concerns, it's phrasing it as an expectation. What questions do you have? And simply stating it that way instead of do you have questions makes it feel a little bit more like it's expected that they will have questions. And so just that simple kind of asking, I know for me, I check in with my daughter. We do that every night. What questions do you have? You know, what do we need to talk about? It just phrases it a little bit differently and makes it like, oh, well, I'm supposed to have questions. And, you know, some days we get really important questions about, you know, life and what's going on. And some days we get questions about why do unicorns have rainbows on them and things like that. So you never know what you're going to get, but it opens up the door so that it is there. So that's one thing that, you know, I think is just a little subtle thing that adults can do. And to do it, make it part of the routine is to ask that question that way so that, you know, you have the conversation.
Great. Thank you, Pam. I like that a lot. Yeah. Do you know the answer to the unicorn question?
I I don't. And now my daughter who's sitting here is like, that's a really good question, Mom. I know. I am going to have to see if Siri knows the answer later.
Yep. All right. Great. Thank you. Yeah, that's it exactly. And it really is important for us to remain open. One of the things that I found in doing some research around this too was, we have to be honest with youth. And if we are struggling, it's okay to let them know, hey, you're struggling, we're struggling. It builds a rapport with them, and they're more apt to be open with you if you're honest with them. Okay. Yes. Yeah, exactly. Volunteers need checking in with as much as youth. Yep. Okay, so what do you think some of the threats in your community are around mental health and stress to our youth? We've heard quite a few of them, things aren't opening up this summer. What do you think some of the others? Schools not opening?
Unknowns,
From
uncertainty.
Uncertainty, yes.
from Lincoln County, I could say one of the biggest stressors of all is the fact that even if school does open, and most of the kids do hope so, we have approximately 80% of our students are very involved, actively involved in after school sports. And that's really, for many of them, the biggest lure of going back to school and doing as well as they can in school. And they're all pretty certain that it's very unlikely that we're going to have sports this year. And that's certainly, I would say, the number one stressor for most of the youth right now.
Yeah, not knowing what's going to happen with schools. And that's exactly, and that's what I'm seeing a lot of, giving them options, opportunities to lead in an online environment, that might be something. School sports, I don't think all of the schools have made decisions. I know my son is still going to football practice every day, not that they have to maintain 6 feet or wear a mask, but they're still doing, so we don't know. Yeah, I think that's probably, yeah, and it was just announced last night that Clark County School is going virtual to begin with, at least completely virtual. So that's going to be, a big one. Lack of support for online schooling. That's family that risk of abuse and neglect is another. That's what they're saying. When you hear about the American Pediatrics, they're saying they need to go back to school for this mental health piece. And, that's a real, so, all right.
I think a lot of, I was just going to say a lot of communities have canceled community-wide events. I mean, up here in Reno, all of the events have been canceled all the way through the end of the year. So, I mean, that's an opportunity for a lot of families to socialize and get out into the community. That's not going to happen.
Right.
And then I would add to that, Bill, in terms of the community events, but if more and more districts go virtual, then extension needs to, there's got to be, we can do it, we already are doing it, but the stressors that parents are already feeling like, and then our limited resource families, when it's, we're going to have a lot of children left at home alone because they don't have the luxury of being able to decide, I'm going to stay home and educate my children or go to work.
Okay. It's stressing the families out and stressing the children out because, when parents are stressed, it's, yep.
Yeah, I think, I was just going to say, I think families, across the spectrum, I mean, most of the stuff we hear about in the media are focused on parents, but in terms of grandparents and that age group, you know, and their stress around possibly getting COVID, that's just another element in this whole thing that a lot of families have to deal with who are in multi-generational settings.
Yep.
I know a lot of the families we work with that are limited resource families, if the parents are considered essential, the older kids are taking on the parental roles for the younger kids, and compounding that with everything that's going on, that has got to be raising their stress levels and affecting their mental health.
Yep. Yeah, very much so. Okay. And then the last, I think we've already answered, I should have probably just put up these two questions. I think we've answered this one, you know, what's happening in the communities. I think we all, you know, it's the whole school. It's been an interest, you know, it is interesting with the schools. And you know, that's one of the things that we need to think about as 4-H staff. What are some, you know, and that's been something we've been tasked with. So Sarah, Nora, and I have been talking about it. We've got to work on it a little harder now, but, you know, what can we do to help our communities for kids that, you know, you know, even if they go to the hybrid model where they're only going to school a couple days a week and, you know, staying at home the other days, what can we do to help them? You know, without being a total babysitting service, but what kind of educational programs can we offer to those youth that will keep them engaged and keep them, you know, give them something to do on those days. So
I think one thing, you know, that the 4-H program it's going to have to navigate is, you know, 4-H is a part of UNR. And many folks, I mean, many faculty are thinking it's a possible good bet that once school starts, we're trying to do this high flex kind of model. But if there's a lot of infection, UNR might immediately go back to, you know, kind of a phase 1 type of, which I think would have implications statewide, no matter where you guys are at, for, you know, virtual programming. And so it's just another stressor kind of on our level, because it's just out of control. We don't know yet. Right.
I think probably for everybody, probably the biggest stressor, and that should probably have been one of our poll questions, what's your biggest stressor, is sorry guys, I can't figure out where my sorry, the neighbor kid showed up, speaking of social distancing. Sorry about that. Dog doesn't like it when he comes. No, I think it is that uncertainty. You know, things change so rapidly with all of this, and it's been going on for so long. I know that's probably my biggest stressor at this point, is not knowing what to do. I want a crystal ball to know. Anything else on any of these topics? Okay, I want to share with you, I know some of you are aware, but some of you may not be aware. National 4-H Council this spring, it was right about the time that COVID kind of hit, they actually had already planned on doing a survey, and they partnered with the Harris Poll to do a survey on teen mental health. And so I want to share with you some of those results, because it really is an interesting, and you're going to get a copy of this PowerPoint deck, so that way, you know, I'm not going to go over everything that's in it, but I do want to share quite a few. What they have found is they actually, and a lot of this does relate to COVID too, but you can, I'm not going to, so the introduction to methodology, you guys can read that. Essentially, they wanted to find out youth perspective on the state of mental health in their community and the nation, especially as it related to the pandemic. They wanted to explore the role of resilience in mental health and health behaviors, and then look at paving a path forward as desired by teens. So they did survey 1,516 respondents in May. So it was actually, I didn't realize it was quite that much. What was interesting is they did survey 230 4-Hers and then 1,200 non-4-Hers. So they were able to actually compare the two groups. So they did define resilient teens. So you're going to see some things about resiliency. And they did define resilient teens as those who agreed with the following statement: I consider myself resilient. So it was a self-identification of resilience, but it is an interesting, the way they compared them. So just to kind of give you a summary, teens today are more confident in their physical health than their mental health, with 81% of them saying that mental health was a significant issue for young people in the United States. And 2/3 believe that the experience of COVID will have a lasting impact on their generation's mental health. So they're 3 times more likely to feel peer pressure to hide their feelings than to do drugs or alcohol, to drink or to do drugs. I think that's probably, throughout this study, that was one of the big things, is they found probably the biggest thing that leads to mental health issues is there's a peer pressure to hide their feelings, which I think we talked about a little bit. So, in particular, teens that are less resilient seem to struggle. They report more frequent feelings of anxiety or depression than those that, said they were resilient. And ultimate, teens are calling for a major change in that mental health conversation, with 81% saying it's time for Americans to talk more openly and honestly about mental health issues in the country. And what they found was 4-Hers are especially likely to have taken action. Either they're donating to mental health charities, they're joining mental health clubs or online communities, or they're advocating for mental health legislation. So kind of the state, you can see, they're facing, just unprecedented times. I think we all are, but they say that sometimes that sorry, I'm going to turn off my email. Okay. Sometimes they feel, sometimes the pressure I feel at home, school, etc., feels like it's too much to handle. And 43% also said that the way things are going, I don't know if I'm going to be able to cope with the stress if it continues at this pace. That's kind of an alarm, that's a lot of young people. The experience of COVID will have a lasting impact. They feel misunderstood by other generations, saying most older people don't understand the struggles of young people today. 65% had been negatively impacted by mental health for society overall. And 65% also say the current pandemic has increased the stress in my family. So you can see, some of those pieces. Here are some of the things that they're feeling stressed about: schoolwork, thinking about the future, no identifiable reason. 65% of the youth that identified as non-resilient had that answered versus 55%. But you guys can see all of those, pieces. And I think, schoolwork, I can see that schoolwork, where a lot of them were having a really hard time last spring, feeling like they were falling behind and not going to be ready for the new year. So COVID's brought on its own unique set of stressors. So you can see these are the stressors that they're seeing. 61% said that COVID has increased their sense of loneliness. So that's, not being able to hang out with their friends and family, going to school online. I think it was Lindsay that said that 30% of the students, from a middle school teacher, 30% of the students never logged in to their online learning system or whatever it was. So, okay, so you guys can see those. 7 out of 10 teens have experienced struggles with mental health. The biggest one being anxiety. You know, they felt like they were anxious or depressed more frequently than their peers. Excessive stress, depression. And you can see, you know, 50% of the non-resilient teens reported that. So, and then more than a third feel those who are anxious or depressed feel it daily. So you can see kind of how often they feel depression or anxious. And you can see the differences between the resilient and the non-resilient teens. Let's see. They have more confidence in their physical health. So you can see, you know, some of these, they give themselves, only 1 in 3 gave themselves an A for mental well-being. So they felt much, you know, they're able to sometimes get out. Yeah. And then this is a question, they feel 3 times more likely to experience peer pressure to hide their feelings than they do to drink or do drugs. So be interesting to see how that compares to adults too. And 75% said there was still a stigma around mental health issues in the country, while 62% said they were tired of pretending to be happy all the time, being sad or anxious. Sometimes it's just part of a human experience. And I think, you know, sometimes we have to remember that as adults too. You know, not all kids are going to be happy all the time, and that's okay. We just have to make sure that depression doesn't hold on for a long time, or, you know. So let's see, this is how they, let's see, the following you use to help when you feel anxious or depressed. So you can see what they're doing.
So the items in black are unhealthy behaviors, and the items in green are healthy. So you can kind of see how they're using more unhealthy coping mechanisms there.
Yep. Thank you. I think I've been doing the shopping online or in person. That's the coping mechanism. No. You know, what do you know, here's what you do. Okay, so you can see, again, unhealthy coping mechanisms versus healthy, way more unhealthy coping mechanisms than healthy. During COVID. I think this was, the first one was just in general. The second one was during the COVID, during the stay-at-home orders especially. Okay. Yeah, this is some of the school thing, or this is resilient. Let's see, for the most, this cycle, I think this was looking at, you know, looking at what has it done. So they, you know, biggest one is not doing well on a test. And then there's how they're spending their time. They spending 75% of their waking hours on screens. So 6 hours is normal. 9 hours is what was happening during COVID. And then how does screen time make you feel? You can see those answers. Leading concern among many teens that these issues are becoming more severe. You know, they asked them, have you worried about experiencing any of these for yourself? So becoming severely depressed or anxious, becoming addicted to social media, contemplating suicide, starting smoking or vaping, becoming an alcoholic. You know, I think it's the first 3 are very interesting. And then here's the role of resiliency in teen mental health. And I want to have some time to talk about some other things too, but you can see, you know, 68% feel like they are resilient, and, you know, they feel like they can cope. But then you look at, you know, some of those traits, you can see some of these traits. I was trying to get to the one where they talk about, right here, do you normally learn, how do you normally learn about mental health and healthy coping mechanisms, and what, and provide the most reliable information? So you can see some of these answers, you know, the 4-Hers versus non-4-Hers. Yeah, Lindsay, it would be interesting for adult studies. I haven't seen those, but it would be really interesting to see the mirroring, you know, see if they mirrored. So
The way this slide is interesting, because the way I read it is that more teens believe that social media and online resources are reliable than do they think that their doctor or therapist.
yep.
I thought that was a pretty interesting statistic. And I mean, of course, it's not well laid out here, but if that's true, I mean, if they really are, they think the information they're getting online is just as reliable as the information they're getting from their doctor, then that's something to focus on and think about.
Yeah. Yep. So here's what would, you know, how have you done, or would you do any of the following? You can see, you know, more 4-Hers have talked, I think it's interesting, more 4-Hers have talked about or posted about their own mental health journey on social media or forums than non-4-Hers, which I find really interesting. Yeah, I definitely will. I'm going to share this PowerPoint, and then there's also a couple of other like supporting documents that, like a summary and infographic that I'll share too. Because we don't have time to go through all of it. You know, we still have another 10 pages. So, but I just wanted to kind of share some of those results with you guys, you know, so you can see kind of what the state is. What do you, you know, as we think about that, do you guys see some similarities to how we were answering our questions about the state of what's happening in Nevada and what's happening, you know, on the national level? Or what that national survey is saying? I saw some similarities, I think, you know.
Carrie, this is Sarah. I did too, in terms of, and Samantha can add to this, is just with the children that we're at, with the Women and Children's Center, the Sierra, just how appreciative the families are that we're actually doing something face-to-face with the kids. And everybody's wearing a mask and everybody is 6 feet apart, and it's been hotter than Hades, even though they have pop-ups for shade. It's still hot when they're outside. So, but the joy is kind of overshadowing all that other stuff. And then, you know, our 4-H, the club programs, there has been kind of a mixed bag. There's been some people feeling really confident, others feeling that are really withdrawing, so trying to reach back out to them just to connect again.
Mm-hmm.
Yeah, one thing I think we have to keep in mind is that survey and those results were on teens. And so it does make me wonder about children, and, you know, there's probably some similarities, but many children, you know, they don't have the smartphones. They're probably spending almost as much screen time, but, you know, they're just in a little different developmental spot.
Right. Yeah. Yeah. But it is, you know, probably it's easier to gauge mental health, I think, for teens than it is sometimes for our younger youth. But okay. So anything else people want to share? Yeah, I like, you know, screen time did definitely go up during COVID because there wasn't, I mean, they were on their screens for school. They were, you know, I mean, it was just like, that's how they had to do it. So,
Yeah, so using that as a barometer of either positive or negative is hard, because screen time is everything. I mean, there's both good and bad screen time, and lumping it all together can be a difficult thing.
Right. Yeah. Okay, so couple things that, and Brian, I don't know if you want, yeah, parents are feeling guilty about that. Yes. I know I feel guilty on a regular basis because my son is spending way more time on the Xbox than he should. But the volunteer survey results, just kind of Jill, if Jill wants to, or Brian, want to just share some of the aha moments. If some of you remember, about probably a month ago or a month and a half ago, we did send out the survey to volunteers asking, you know, what are some things that we can be doing to help you. And so Brian and Jill have been sifting through those results. Did you have a chance?
Yeah, and we're at that really weird phase where Jill and I are trying to make sense of it all and trying to come up with those so what bullets. And I'll tell you that we're probably a week away from having that. And I'm reluctant to share much right now just because, you know, it's still sort of up in the air. So I'm sorry that we don't have more to tell you. It's kind of one of those, well, what can or should we share, and what can or shouldn't we? Couldn't. So
Well,
I'm not sure what to say.
Yeah. Well, you had made a comment the other day about there was a relationship between the amount of staff support and how the volunteers were feeling. And so
we were one of the first things. Yeah, that's right. Thank you. One of the first things we saw, Jill and I both noticed that usually, you know, when you survey, and all of us have done it, survey volunteers about a controversial topic or something that's affecting them, you know, we kind of have this expectation that we're going to get a lot of constructive feedback, not necessarily all negative, but mostly constructive and things we can do to improve. And that's why we asked those questions. But we were kind of blown away at how much positive came out of this and how many people said, you guys are doing a great job. Thank you so much. I mean, out of the 60 respondents, I think we counted, I think there were at least 12 different people that felt the need, and we didn't even ask the question. They just felt the need to put in an optional space. You guys are doing great. I think it was 4 or 5 of our staff members actually get mentioned by name in the survey. So it's that, and then we're looking into some other things and how that maybe affected the rest of their responses. But that's the part that's still kind of like, we're not sure. So we have to be very careful about what we say so far. But yeah, I think getting more positive responses than we expected is one silver lining.
Yep.
Sorry.
And I would just say that maybe we can probably be safe to say that we are seeing some resilience and, you know, we're fleshing that out a little bit.
Several people directly used the word.
Mm-hmm.
So yeah, there was a sense of efficacy and resilience in there as well. These were strictly adult volunteers.
Right.
No youth were surveyed.
Yep. So the other thing that we, you know, what kind of things, when you think about risk assessment for youth programs, you know, as we're sharing, what kind of things do you think you as staff or volunteers need to be thinking about when you're deciding, should we do this in person? Should it be virtual, you know, for our meetings and our activities and our events? So I just wanted to kind of get we have just about 5 minutes and we got a couple more questions, but, you know, that's something for us to think about a little bit.
Carrie, when we knew that we were going to be able to start our day camp, the things that Samantha and I had to, you know, that higher level thinking is that, and I've said, some of you have heard this before, but each child had to have their own kit. And, you know, there was no shared stuff. So there, you know, that could cause a budget issue for some counties when they wouldn't be able to You know, usually you can share watercolor things, but now every kid had to have their own paintbrushes, their own watercolor palette, their own scissors, their own glue sticks, their own everything in a plastic tote with their name on it, and it gets wiped down at the end of each day. And then when the summer day camp is done, that kit goes home with them. And so it used to be that, you know, you share resources because there's a box of crayons that gets shared around. And as now everybody has to have their own.
Yeah. And Jill, we're going to get to that question. But thank you, because we do have. Okay, anything else people want to share about some of that risk assessment type things? If anybody ever wants to talk through something, you know, most of you know risk is the first thing I think of. So drives my family crazy, and I know Sarah's really good at it. Nora's good at talking through some of those things. So we also wanted to kind of ask if anybody's had if you've encountered anxious parents that are, you know, anxious about COVID, and what have you told them about that? I know I did get one question about a release, you know, having people sign an extra release for COVID, and, you know, it really came down to, we don't really need an extra statement, because as long as they're following the guidelines that have been set forth by the university and by extension, they, you know, they are covered. Now, if they are not, and, you know, then they're not covered. So, but anybody else have any anxious parents that they just don't want their kids to come back to 4-H? Okay, Stormy has. Okay, yeah, we know that there's lots of negativity about wearing the masks too, but we're gonna side on the air of caution. Okay, Sharon's had some. If you guys want to send me, you know, how you've dealt with that, I would, you know, I'd be happy to send that out. You know, if you were able to do stuff, you know, that would be great on how you've dealt with that. It would be really good to share, you know, to share that with everybody. And then the last thing I wanted to share with you, we have put together a pretty extensive resource list that we are going to be, and of course it closed up, that will be, you guys will get. Okay, sorry, I'm waiting for it to open. There we go. That it gives you quite a bit of thank you to Bill and Pam and everybody that really helped pull this together. You know, we've got some information, you know, we kind of put an introduction. We need to remember that we are not licensed professionals, but we should really have a good understanding of the signs of mental health distress. And so we, you know, and one of the things we're looking at is trying to do some training for staff and volunteers on, you know, more in depth. But here is a whole, I mean, it's 2 pages of resources. So I'm just gonna, you know, you can see I'm quickly kind of going through these, but so you can, you know, you can feel free to go and to go out and look at that, or to go look at those. And again, you know, we just wanted to give you some pieces that you could use. So, and yeah, Sarah, it is, you know, the face mask thing is not something that we can change, nor we have to make sure that everybody is safe. And so, you know, that's not going to change. And we need to have that consistent message of, you know, we require face masks.
But I mean, now that we're starting to hear nationally how important it is, and there's health officials that are saying, wear a mask, wear a mask, wear a mask. I think that will kind of go away a little bit, I'm hoping.
Yeah, yeah. So, and then we're interested in knowing what, and I know it's 4:31. So we're interested though in knowing what the training needs for personnel and staff, and for what you guys, what are some training needs for if you're going to do in-person programming around, with our guidelines that we currently have. What kind of trainings do you want really? And this is related to mental health too. If you have other ideas of training needs, let us know. But we're really thinking about mental health, the blended learning programs, and then also some virtual opportunities. I know like Clark County is offering a virtual, there's a curriculum called Navigating Your Mind, I think is the name of it, out of Ohio State, that's a mental health for teens, and they're offering it virtually. But if you've got ideas, it would be great. And then,
Carrie,
sorry, go ahead.
even if we could build, this one resource we listed, but if we could also develop another resource list for training needs, because I would say that Washoe would say yes to all three of these. We know how to do in-person programming, but now in the time of coronavirus, we need all that. And then how we do blended and how we do virtual, all of those different things to be able to make sure that we're reaching as many people as possible.
Okay. Yep. And then Jill mentioned the assist suicide training. If you have ideas of trainings like that, that would be great, that we can look into. And then I'm not going to go through the importance of self-care for adults, but when you get the PowerPoint, you're going to see that. So, here is, we're really looking at some of our next steps we're going to be focusing on the topic of mental health, especially youth mental health. To me, it's critical that we do that. We're working on trainings for paid, for all of our, my goal is to have all of our paid faculty and staff and our adult volunteers get trained in youth mental health. And so I've applied for a couple of grants, haven't been successful on those, but eventually we're going to get those. We're going to get funding, and if not, we're going to figure out how to do it. Otherwise, I think we can do it. And then we need to be thinking about programming both at the county and the state level for youth around mindfulness and coping with stress. And some of those, I know Sarah's talked about doing a mindfulness like summer camp type situation or an overnight camp. That would be, that's something you could do some kind of retreat. And it's amazing how many youth are actually very interested in this topic, So yeah, train the trainer to teach volunteers how to use virtual platforms. Yes, I've got all that on a list, and I think we're going to have to, we're going to be moving towards that. How to teach on a virtual level, how to make things interactive, all of those. So. All right, sorry everybody that I kept you 5 minutes over. I try not to do that. But any last minute comments, thoughts? Know that we're going to be looking at doing more and more trainings around, mental health, just because you all, we all need to have information. So. And thank you to, the facilitators today for helping us. So you guys can, send emails, send texts, whatever, if something comes to you in the middle of the night around youth mental health. But know it's one of our focus areas. All right, thank you.
Thank you.
Is this the same link or is it a different link for the next
A
one?
different link.
Okay. So it's in that same message. I'll just look.
Should be.
Cool.
If not, let me know and I'll send it.
So Carrie, if you want to stop sharing your screen and
No.
do it anyway.
No.
So who is Carrie's